What is the case if you look at our society now? The case is that in the United States, every 3 weeks, you have the equivalent of a 9/11 in terms of the number of people dying from drug overdoses. And not just from overdoses, not from drugs, not from addictions in general, just from drug overdoses every 3 weeks on 9/11. What is the case? The case is that if you look at the rate of multiple sclerosis, the gender ratio, in the 1930s, 40s, about 1 to 1. You know what it is now? 3.5 women to every man. The case is that the number of non-communicable diseases is going up, that the number of autoimmune diseases, people diagnosed with autoimmune illnesses is going up in our culture. The case is that mental health issues are burgeoning, that the number of children being diagnosed with one or another so-called medical disorder, and I do say so-called very strongly, whether it's ADHD, anxiety, depression, so-called conduct disorders, oppositional defiant disorder, pervasive developmental disorder, not to mention the autism spectrum problems, is burgeoning. More and more kids are being medicated all the time. Anxiety is the fastest growing diagnosis amongst our youth. This is the case. And what kind of explanation does our society provide for these burgeoning problems? And how do we explain these things? Where I'm a medical doctor, I trained very much in the mainstream medical tradition, just as at least two of the other speakers, Bessel and also Dan Siegel was trained in. And fundamentally, our training is in a modality that sees the mind and the body separated from one another, and the individual is separated from the environment. And society and culture play almost no role in the onset or the dynamics of illness. Now, this model, of course, reduces everything to individual biology. So in our society, addictions, for example, are seen as either personal choices, in which case the solutions are behavioral and educational, or punitive, or deterrent, but all we're trying to do is influence individual behavior, pretty much as B.F. Skinner would have done in a laboratory with rats. Basically, if you want a rat to go to a certain part of the cage, you give him sugar. And if you want to avoid that part of the cage, you shock his foot with electricity. But you don't care what the rat's internal experience is. And you don't care what the rat's relationship is to the environment in which he lives. You just want him or her to avoid or to move to a certain part of the cage. And that's our approach, by and large, on a social level to addiction. And so we have the former, recently resigned Attorney General of the United States, Mr. Jeff Sessions, who says that basically what we have to do is to have programs such as we did in the 1980s and the 90s that just tell people to say no. And that these programs, we used to have these programs, he says we can do them again, and then people will not make these bad choices, and he actually uses the word choice. And that's the dominant model in our society, is that people behave, stay well, or get sick fundamentally on personal choices that they make. Now, how successful that choice model has been in preventing addiction and telling people just to say no is shown by the fact that every 3 weeks you have a 9/11 happening. But that little fact doesn't penetrate on mainstream thinking. And it certainly doesn't have any impact on legal thinking on addiction. Now, the other approach to addiction, of course, is the biological model that addiction is, and you know, in my workshop I'll be saying a lot more about this, but the point I'm making is that the other model is the medical model, in which addiction is primarily a disease of the brain, and in order to understand it, we have to look at the genetics and the individual predisposition and brain architecture of the individual. But again, it's an individualized view. whether it's a choice that somebody makes on a conscious level, or whether it's a disease that somebody's programmed or doomed to have because of personal biology, we reduce it to the level of the individual.